Sacramento County Prevention Planning journey. We're very excited and honored to welcome Sheila Boxley, the President and CEO of the Child Abuse Prevention Center, and Michelle Callejas, Director of Sacramento County Children of Family, Child, Family, and Adult Services. So welcome. It's a mouthful. Thank you so much. Welcome.
Good morning. Thank you so much. We're delighted to be here today. We are on the same journey as all the rest of you and all the other counties. And so hoping to learn from each other today and tomorrow, and obviously starting yesterday. Michelle and I wanted to start out with a story. It is a true story about something that happened in Sacramento County. And the story starts out really kind of sad because about 25 years ago, over a period of about 18 months, we had a series of really tragic child deaths due to child abuse and neglect. All very young children, very prominent in the headlines. And I can assure you that all of the news feeds were all about this, on and on and on. The community was upset. The county departments were under fire. The county board of supervisors were being talked about in op-eds pretty much daily. And so it was a really serious time. So I think those of you maybe who have been around for a while know that when things like this happen, there sometimes is a knee-jerk reaction. Well, let's put up the barricades, let's go internal, let's be really sure that nobody can die because we're going to have them all under surveillance and we're going to have more kids substantiated and put into foster care and so on. And we've seen that has happened before in communities. That's not what happened in Sacramento County then. Something very different happened. So in this story, you have some characters, and some of those characters include pretty much brand new director of child welfare and director of the CAPC. So they didn't come with a whole lot of baggage to this, and were barely starting to work with each other, but came to realize that both had been really looking at some evidence-based prevention programs and models and thinking that there needed to be some changes. Another character in this story was a champion on the board of supervisors who really believed in prevention and going farther back and helping families and communities. There were also some additional characters in that over 20 organizations, both public and private, were already working together for over a decade in a child death review team. And they had been collecting data, not just on children who were suspected of child abuse, but looking at all child deaths. And so there was a plethora of information available. Just so happened that at this point in time, it was time for the annual report from the Child Death Review Team to be presented to the Board of Supervisors. And you can imagine in the environment that we were in, that the press was right there waiting for that presentation and for those recommendations. Those recommendations were from all 20 plus organizations, but it was the responsibility of the CAPC director to provide the overview and the recommendations. So the primary recommendation was, let's get serious about doing some prevention. And there are some existing models, particularly home visitation at that point in time, that we know are working in other places. So let's start to do it differently. And so next to the CAPC director was the child welfare director agreeing to that same recommendation and knowing it was on behalf of all those other organizations. It was a great opportunity, frankly, for the Board of Supervisors because, okay, you guys have given us a solution, it's in your hands. And they did very much put it in the hands of the organizations. And that champion said, okay, you two directors, here's what I want, and it has to be done in 6 weeks. I want you to get together. I want you to have a big convening. I want you to engage anybody and everybody from neighborhood associations to providers, to individuals, to advocates. You need to bring everybody in and really talk about very specifically within 6 weeks, what the programs are that need to happen, where they need to happen, etc. Well, the two directors said, of course, we'll do that, and then walked outside and went, oh my goodness, be careful what you ask for. But what happened was that they had to pull their teams together into one team to really get that work done and to make it happen in time, because this was the opportunity. And indeed, there was this giant convening, in addition to all kinds of focus groups and other kinds of outreach. We brought in the national experts in Healthy Families America, Nurse Family Partnership, et cetera, et cetera. Well, this is what the community said back. They said, yes, we want those home visitation programs, but we don't want them in the county or in some big building. We want them deep inside our communities. And so what they were asking for were family resource centers embedded with home visitation. That's what happened. And within 6 weeks, because of all the data that we had already about where the needs were and so on, we went back, those two directors, and said, these are the programs. This is where they need to be in the community. This is what the community has asked for. And in one instant, the champion said, we're going to give you $7 million and go make it happen. But we want to hear back every year about what you're doing and what the differences are and what changes you've made. So what really happened then was a culture came about of transparency, of collaboration, of shared responsibilities. And what we had in that time, which has continued in Sacramento County, is very much what is helping in this process now of doing the planning that we all are engaged in. We had leadership that was committed to prevention, that had a shared vision of what needed to happen. We had community input and engagement, probably more than I've seen before at any one time, with really deep into communities and also providers of all kinds, public and private. Cross-sector, we already had an existing collaboration of over 20 organizations that have been working together as the Child Death Review Team, and that sort of morphed into a family support collaborative that began to really look over and have responsibility for this new program. And then data. We had a lot of data. I want to give a plug. If you don't have an active child death review team in your community, really think about it. It has been the pivot for major policy changes because of the strength of the data and the collaboration of all the organizations that are involved. There's one more element that was present then that's present now, and I'll turn that over to Michelle.
Thank you, Sheila, and good morning, everyone. So the shared power is such an important component of doing this work within our community. And I don't think that there's any child welfare director in the state that wouldn't say we cannot do this work alone. We've got to have community partners. We need folks who are going to have a shared responsibility, shared accountability. And the only way to get there is for us to be willing to share power, to share decision-making, to utilize what we did with this approach and a more recent approach, having a backbone agency like Child Abuse Prevention Council to administer the funding with community-based partners that we all know are more trusted than child welfare agencies, but they can help support the work that we do. And they are so effective. They're in the community, they're on the lines, they're trusted by community. And so we have to be willing to share that power and allow for decisions to be made outside of us. And that can be difficult at times, but what I continue to learn is to trust the process, to trust the community. It's why we engage families and youth and get their voice, because they know more than we do what they really need. So yesterday, Stuart Oppenheim gave kind of a great summary of how we got started on this journey of prevention. So I won't go into all the details, but I will just share that we had a speaker come to our Child Welfare Directors Association meeting, I think late 17, early 2018, Robin Jenkins, who's a professor out of University of North Carolina at Chapel Hill. And he's amazing. He's an amazing speaker, dynamic, and such an advocate and so passionate in the area of prevention. And he's worked in law enforcement and substance use and mental health and the child welfare area. And he really posed, the question to us about how we could embrace a more upstream approach, a prevention approach. And to be honest, at least from my perspective, we kind of like struggled with it at first as child welfare directors, right? We're like, well, wait a minute. Our systems are designed to respond. We react, right? When we get a call to the hotline or when law enforcement calls out. and that's what we do. And most systems that we work with, like behavioral health, probation, education, right? They are systems based on mandates because of critical community needs. But I think as we all kind of just kept talking through it, we all recognize that we have high caseloads. We have young people in our foster care system now that have such an array of complex needs. We know we need more help from our community-based partners. And so maybe this was a time to really look further upstream, not really knowing what that looked like but knowing that is something we needed to do. And I think it was such a pivotal point on helping us to continue to have this discussion around prevention, what it means, what the role is of the Child Welfare Agency, as well as our cross-system partners, our community members, our training academies, right there. This requires such a comprehensive cross-sector approach. So, what Sacramento County did was really took advantage of this this statewide movement and discussion on prevention. And Stuart referenced yesterday the first summit, which is a picture of which you see on the slide, that was held in January of 2019 down in San Diego. And I think there were 33 applicants, counties that applied, and the state was looking, state CWDA strategies were looking for teams of 10 from each county with cross sectors at the table, decision makers. And we were fortunate to be selected as one of the counties. And that really was the launch of our effort here locally. We came back, we added a few more partners, and Sheila will go into it shortly about who we've involved, but is a really strong cross-sector approach with leadership that is committed to this journey. And we've been working ever since. We continue to meet monthly, disrupted a little bit early on by the pandemic. But Sheila will also talk about a Department of Justice grant that we got that really kind of helped us focus. Because to be honest, as we launched this prevention work and this cabinet, we kind of struggled a little bit to see, okay, where are we going? What are we doing with this? And so the Department of Justice grant helped us to get focused. And now with the FFPSA, we have a little more focus. With AB 2083, we have some more focus. So that's how we got to where we are today. And I'll kick it back to Sheila.
As Michelle had mentioned, we were very fortunate that we were able to get a grant from the Department of Justice. Sacramento County is one of 5 sites in the nation. It was one of those grants that is by the pound in terms of getting the access, but we were very pleased about that because it gave us some funding to support our staff in terms of doing the backbone supports and services. And very importantly, it opened the door to access to lots of very prominent consultants in a whole array of areas related to this work who have been very helpful to us. The goal of the Department of Justice grant is to reduce child abuse fatalities and near fatalities. And while that's not the be all end all of everything that the Prevention Cabinet has been working on, it is very much aligned with that. And so it has been a great blessing to have now 3 years of funding to support our work with this. And I have to acknowledge that trying to do that without any other support is a heavy load and a real commitment. And so I think that's, something that we really respect in all of our colleague counties who are doing this work. This is a diagram of our membership of our cabinet. And we have currently 27 individuals who are members of 19 different agencies. And you can see, looking around the wheel, if you will, the categories that they fall into. We've got judicial system, law enforcement, probation, investors, including First Five, case and family programs, and others, healthcare, education, health services, child abuse and neglect service providers, child welfare, and then other community groups like family resource centers being represented as well. We have 4 committees: data, systems, community engagement, and then we have our backbone agency, and that's the CAPC. Although quite frankly, it's a joint backbone with child welfare, and so we do have those systems in place, and it's been really helpful to have the support of the staff to really keep all the committees going, as well as the whole cabinet. What you see in the middle of this diagram, however, is what's critically important, and that's the parent, youth, and family voice. And we're going to talk a little bit more about that in detail in terms of how we really incorporated that into the cabinet. I do want to mention that we also started with an evaluator right away, so that we had that support of helping us with our data, with our theory of change, and with other elements of this, as well as keeping track of our progress. Importantly, they also do something that I think is very helpful in maintaining the stability of the cabinet, and that is that they do a survey every year that includes all the members of the cabinet, and I don't know what everybody says, but they give us all back the results, so we see how we're doing and what the temperature is of the cabinet itself, and that's been really helpful in that sustainability part. We collected and looked at so much data that we could spend a whole day showing you all this data, and you don't want us to do that, but we were very fortunate that we had over 20 years of child death data from that team, and we had the access to all the near fatalities, the critical ones that were in child welfare. And so we were able to look at a 10-year period of time from 2009 to 2018, taking all that data collectively together. And what we saw was that there were 140 children who had been victims of child abuse, fatalities, or critical injuries. We saw that they were mainly younger children, about 80% of them, 50% of the total were infants. We saw that the parents were the primary perpetrators, and we saw that there was a pretty extensive child welfare connection. But we had a lot of additional information. And again, we were very fortunate because of the child death review team. We knew the locations, we knew where, we knew what communities where the deaths and the critical incidents had happened. We knew more about the characteristics. We knew if the parents had a background in child welfare, if a sibling had been in child welfare. We knew that that the families tended to be in poverty, and really the way we were looking at that is whether they had accessed benefits, and about 59% of them had. And likewise, we knew that 61% had a substance abuse issue. So we were beginning to look at the risk factors. We knew the geography. We knew the characteristics of the children themselves. And then, of course, we also wanted to look at the disproportionality, because that has helped us focus, and really in 2 primary areas. One of them being looking at the age, that the youngest children were certainly the most vulnerable and the most at risk. And likewise, we looked at the race and ethnicity. And again, I want to be clear that this data is not today's data. This was through 2019. But when we look at that, you can see obviously where the greatest disproportionality is, and that is that African-American children were 40% of those who either died or experienced the critical injuries, and yet they're 11% of our child population. I do want to say, just in terms of data, that some things have changed and been going certainly better in the county since 2019, and the number of children going into foster care has been reduced substantially. And certainly Michelle can speak to that later. But we also have had some really important, very sophisticated quasi-experimental design studies looking at what our home visitation and our family resource centers have done. And we've had 2 of those, one with a control comparison and another one where we were looking at sort of time frame. And in both cases, we had really important outcomes. We saw that, for example, with African American children, what we have had is a decrease in the number of children dying, but really importantly, a decrease in the disproportionality, which has been very important. We've also seen, in terms of our home visitation, that as little as 8 hours has made a substantial difference in the likelihood of those families entering or re-entering child welfare. So we're happy to share some of those evaluations if people are interested. We have a lot of that data. And I think it's important when we're looking at data about understanding what's happening in our community, we also need to look at what's working and what's been making a difference. And we've been very fortunate, not only with our family resource centers, but again, one of the other recommendations from our child death review team resulted in the Black Child Legacy Campaign, which has been making significant differences in that population. So again, another plug for your child death review team. But you know, it's real hard for people to say no to those recommendations when they come from that kind of data. So next slide, please. We basically did a halt somewhere along the way and said, you know what, we're doing all this analysis and so on. We don't have all the voices here that need to be here. We don't have the people with lived experience who are here at this table. And we've got to stop making decisions and moving forward until we rectify that. And so fortunately, our community engagement committee really took this on with a passion and did some really great work. They developed a matrix to make sure that we could really access the diversity of those with lived experience so that we could get a variety of voices like youth, parents whose children were in the system, so on, so that we could have some real clarity and really good information. We knew we wanted to recruit people and decided that no one would be turned away. You might not decide that you want to be on the cabinet and go to all the meetings, but there were other ways that people could be engaged in this process, whether helping with a focus group, whether maybe perhaps just being on one of the committees and so on. And this is not a one and done part of our process. This is an ongoing process to continue to increase the level of the voice of those with lived experience. So our wonderful committee also came up with an application process, and we used it far and wide. All the providers were sending it out to those that they have served. So did the agencies. Probation has a group of community advisors. First Five does. All of those people were given the access to these applications, and obviously that's available to any of you who want to use it. We also developed a role description, sort of like a job description, but what were going to be the elements of this. And importantly, it talked about certainly, what the timeframes are and the attendance and all those kinds of things. But really more importantly, it also had in it what the responsibilities were of the existing agencies who were on the cabinet and how they could be supportive of those coming in with lived experience. So the good news is we did get some applications, and some very, very good ones. They were de-identified. So in terms of just looking at the application, you didn't know who it was specifically. The committee then did have 30-minute interviews with people to talk about what the work was and so on, and see what their particular interests were. And then there was a selection, and we do indeed now have not as many as we want yet, but we do have truly people who are committed and have that lived experience. Next slide. Importantly, we decided before we even did any recruitment, we were going to provide stipends. I get paid to be there. Michelle gets paid to be there. All of us from organizations are paid for our time, and we wanted to make sure that we did that in a fair and equitable way for our community representatives. We also assigned mentors to the new members, the community members, so they could get up to speed, so that if some of this, we got into jargon and unfortunately would maybe be doing acronyms, we could make sure that there was somebody there who was also supporting that member. They also have gotten some support from CAPC, and they've received an orientation and an onboarding so that they're really ready and are an equal voice, not an advisor. They are a member of the cabinet. So with that, I will turn it back to Michelle.
So based on the data that Sheila referenced earlier, the 10 years worth of data, the prevention cabinet established a pretty bold vision, which was to eliminate child abuse and neglect deaths and critical injuries by 2030. And we played with reduced by 70%, 80%, 90%. And we really wanted to have the bold vision of eliminating child abuse and neglect deaths and critical injuries entirely. Audacious, yes, but we think that if we really put together a strong strategic plan, we can get there as a community. Excuse me. Some of the data that we looked at was also about the economics of child abuse, which was put together by Safe and Sound. I believe they did it for every single county. So if you haven't seen your counties, I think it's really important to take a look, because it's great information to be able to use as part of the ongoing communication that's needed in order to really discuss prevention with different partners, and certainly with county board members in advocating for funding. So in 2020, there were 2,504 substantiated victims of child abuse and neglect in Sacramento County, and 2 child abuse and neglect fatalities. The cumulative impact to Sacramento County, fiscal impact for those victims, is $919 million, pretty significant. And although these costs are accrued over the years in the course of the victim's life, they continue to incur the same cost each year until we're able to reduce and ultimately eliminate child abuse. So Safe and Sound does a great job of even breaking it down further. Excuse me, I got a little frog in my throat. So looking at the cost of child welfare, $197 million. And that's looking at the intervention services that child abuse victims will need, foster care payments alone, understanding some of our kids go to group homes with much higher costs, and the counseling services that are needed, reunification services that we pay for from the mental health and substance use perspective. Education, $40 million. We know that abused children are 77% more likely to have special education needs. Criminal justice, $20.7 million. We know kids that are involved in the child welfare system are 60% more likely to be arrested as juveniles and 28% more likely to have an adult criminal record. Lifetime productivity, victims are more likely to be unemployed and rely on public assistance, which leads to diminished earning income potential, $418 million. So you can see these costs cross systems and are significantly expensive within community. So when we talk about the importance of child abuse and neglect, this is really good information when you're trying to convey the fiscal impact. We also always want to convey the importance of child and family well-being, elimination of child abuse and neglect. But this also tells the fiscal side of it. And imagine the services that we could provide if we directed this money elsewhere. So with our vision locked in, we developed a theory of change, and we cringed when our evaluators started talking about theory of change. I think everyone's like, oh, theory of change, blah blah, we don't need that. But it was really important, and we took the time that we needed to delve into it. And we developed our theory of change that outlines the foundational values that cross-cut all 4 strategies that will get us to our vision of eliminating child abuse and neglect deaths and critical injuries by 2030. And we worked hard on the values, the strategies, and lining it right into our vision of success. The prevention cabinet, we started a needs assessment. Multiple folks that were contributing into this needs assessment to identify key strategy areas that we could use and implement to strengthen our prevention efforts as we built a system of care. So you can see our community, family, and voice, and we put down what we meant by that, right? Recognizing the need for the intentional and genuine engagement of community, parent, and youth voice. And Sheila talked to the process that we put in place, the mentors that we assigned, the onboarding of them. We also understood that you can't have just one voice at the table. It's important to have an array of voices. It's important to really help them understand the process. The last thing we want to do is have someone on the cabinet just to check the box, right? See, we had community at the table. It's really important to help folks understand, to onboard them, to get to that meaningful engagement. We developed racial equity strategies, trauma-informed systems and practices, and the building and implementing a system of care. And this part is really important. I think, many counties are involved in the AB 2083 work, and Sacramento County, which again, I just love this county. Our interagency leadership team from the beginning pushed to include our prevention partners as part of our system of care work, because we knew that you couldn't have a strong child and family system of care without having primary prevention at the forefront, right? That's got to be the beginning of the continuum. And then secondary, tertiary prevention strategies scattered across the continuum, all the way into aftercare services. And so we have our first 5 partners at the table. We also invited our Department of Human Assistance, which are our self-sufficiency, because we wanted to ensure that we were addressing benefits, addressing concrete economic needs of our families. Again, we all know like roughly 60% of our families are involved because of neglect. So really looking upstream, addressing the social determinants of health as part of that system of care. On our prevention cabinet, we have a standing agenda item of an AB 2083 update. And then also on the AB 2083, we provide prevention cabinet updates. One of the things we're discussing right now is how we use our prevention cabinet as a form of governance structure for our FFPSA work. We've done so much work as part of our prevention cabinet that's going to help inform our FFPSA community prevention plan. We have more work to do, but there's so much that we can draw from. And so we really want to use that as a primary body to help lead forward our planning. The other thing we did with our AB 2083 is we invited the juvenile court to be involved. So actually our presiding judge and I are the co-chairs of our interagency leadership team, because we really want our courts to be aligned. And we have a great presiding judge who's now getting more seeped into the prevention aspects, which is also going to be critical for our community. So after establishing the strategy areas, we started to create and then refine activities and correlating actions to each of those activities. And we just wanted to highlight a couple of the areas. So looking at racial equity, and again, we have such a strong evaluation team, and they just guided us through this process. And I'm telling you, there were times it was tedious. I wanted to pull my eyelashes out, but it really helped us stay focused on what it is we were trying to accomplish. So promote and support family serving organizations to conduct organizational assessments of equity policy and practices. So part of what we want to do as a team is identify and share best practice tools and resources for organizational self-assessment, cross-training, use of surveys and consultants. In our child welfare, we engaged gosh, I just spaced on his name, but doing implicit bias training, and Dr. Bryant at a Morehouse. And we invited we started at leadership, and we had 2 4-hour sessions just for leaders. And we invited leadership from CAPC, from probation, from child welfare, behavioral health, community-based partners, public health, gosh, so many different, district attorney's office. Our county executive actually participated as well. So kind of doing this shared learning, because we know that you can't just shift one system. Our families tend to touch many systems. And so we are all really committed to doing that cross-sector work. The trauma-informed systems and practices, one of the actions that we identified, the 3.2.1, reviewing policies, procedures, training, and practices within and across systems and agencies with trauma-informed lens. Our partners over at our Sacramento County Office of Education is doing amazing work, leading community work on our ACEs. And so really leveraging what it is that they're doing within there, but we have many representatives from all the systems that are also involved in that work, which just strengthens that trauma-informed lens, again, across the systems. We're also lucky because, and we need to do a refresh training, but we have a court that went through trauma-informed training. And again, I think we need to do a refresher, but just having that openness from the bench is so critical as we work to reduce trauma just in the courts alone. One of the things that our evaluators did was using the Mentimeter, which is so cool because it's all live and we get to see everyone's thoughts playing out. So once the actions and activities were established, we moved to prioritize in order to begin like kind of 6-month increment, 6-month action plans. And so we also looked at what was achievable in the short term and what we thought we were most ready for. So it's not just let's go do it, but what is our readiness around each of these activities? So cross-training staff to increase understanding of trauma, reviewing the policies and procedures for trauma-informed, identify best practices to address secondary, right? So you can see all of them and you can see whether folks thought we were very likely or not likely. And so from there, you could see where the priorities were. So our first launch will be focused on reviewing the policies, training and practices with the trauma-informed lens and making recommendations to reduce further trauma. I think to some degree, many agencies involved in this work are already doing it. It's really good. I think everyone is really shifting to that, if they haven't already, really shifting to that trauma-informed, but understanding that it has to be an ongoing effort to understand that different areas, the different touch points where we unintentionally induce more trauma and how we can lessen it. And again, it's got to happen cross systems. If child welfare goes in and does nothing around trauma-informed, but behavioral health does and probation, it's not going to help if that child is involved in the child welfare system, right? We all have to be swimming in the same direction, rowing in the same direction. So this is kind of how we laid out every single activity. So just to close out, I think what's really important, first of all, I'll say this has not been a smooth journey. I kind of relate to it more as a hike. And it is going back and forth. And I don't know if some of you out there who like to hike use those apps and they rate the hikes as easy and moderate and hard. And I was on one recently that said it was easy, and I was cussing at the app the whole time because it was not easy, right? And I thought prevention, I'm all jazzed about it. This is going to be easy. It's not been easy. It has been fun, but it's not easy. And it's something that we have to keep pushing through and working together to get there. I think everyone's still reimagining and envisioning how child welfare embraces prevention, primary, out in the community, supporting and sustaining that work. The communication piece is critical. This Sheila every year is so great about getting before our board, and we partner on recognizing Child Abuse Prevention Month. And we use that opportunity every year to message something. And the last few presentations that we've had before our board, 3 this year now, have all focused on the importance of prevention work. And so again, as Sheila talked about, using the data, that's so important to communicating the message, using the information on the economic impact that Safe and Sound put together. Also understanding cost to other systems. We did a huge ask in our budget this year to support prevention work. We're using it right now, all our realignment, local general fund dollars that our board is supporting, because we were able to show, right, over the last 6 years, we have reduced the number of kids in foster care by 5% each year, which is pretty amazing. We reduced entries by 58%. If we can reduce by another 5% in 1 year, we save foster care payments alone $1.5 million. And that doesn't include group home care. That's just a basic foster care rate. Doesn't include the social work costs, all the other service costs. So understanding your data and using it to message, depending on the audience, is really important. And then a few people have talked about sustainability, and that's going to be the critical piece. This prevention work cannot be one and done, or we've got this great prevention program, they're going to do it all. I think the blending and braiding of funding is critical. I know Franny mentioned a couple of the funding streams. Locally, we use CalWorks dollars for some of our home visitation, First Five, local county general fund, realignment. We can use MHSA money, education money. Sheila's done great with leveraging AmeriCorps funding to get more family voice and involvement, right? So there's such an array of resources that we can use, but we cannot be dependent upon 1 or 2 funding streams. There's got to be that cross systems approach. And I think that's one of the things that I'll just say is really to consider how you can integrate this work and your AB 2083 system of care work, and how you can ensure you continue to get partners at the table. I loved looking at who's on the webinar today. So I just took a few. We've got public health, we've got CAPCs, we've got probation, plus their statewide organization, CPOC. We've got community partners, First Five, regional training academies, researchers, evaluation teams, education, behavioral health. We've got parent partners, and then we've got our prevention partners. And that we need that wide array of partners in order to do this work and in order to really promote child and family well-being.
Thank you so much, Sheila and Michelle, for sharing this amazing, planning process and just all the work you've done. I know there were some folks who had some questions.
In regards to the community members and the people with lived experience, one of the things that we've struggled with in LA is to figure out the best way to be able to ensure that they are compensated. Did you run into any issues with that? We've talked with our county council. The procurement process seemed pretty rigorous, and providing funds outside of that through contracts, there was issues about a gift of county funds. So I wanted to know, how did you kind of overcome that, if that was an obstacle?
It was not an obstacle at all. We decided from the very beginning that that's what we needed to do. And we did have some additional resources because we had the grant. So that was helpful. So we really didn't have, any sort of administrative blockage or anything. It was really pretty straightforward.
And it's a great question, Corey, from a county system, because it has been difficult for us to do it, which is why we use our partner organization to do it. We we use gift cards with our FIPPERS funding, right, to be able to support families early on, to be able to take kids right into care, particularly relatives. It is an arduous process to be able to get to it. But I wish there was more flexibility. When I was in the mental health space, I mean, it was specifically designated that MHSA funding could be used for stipends, and that was really helpful. It would be great if the state could move towards some flexible funding that would specifically allow for child and family involvement. As Sheila said, we're all paid to be at the table. And if we truly believe children, youth, families have lived expertise, in my opinion, they ought to be paid for that expertise in helping us shape a stronger community safety network and contributing to our work.
And I think that's a good point in general. One of the great things about being in partnership with your public and private agencies is, the private ones can say things that maybe everybody would like said sometimes, and can also be more flexible in things like the stipend. So, work together on those things.
Jasmine Brosnan, who's part of the team, has added in some, I think, helpful links just about the information that some folks were asking. And also Stephanie and Elizabeth were just sharing some funding opportunities for these types of things, like the ARPA CB CAP funds. Stephanie mentioned that they have a Department of Justice grant that helped paid for that. But I think that's a wonderful reminder that if we ask community to come to the table, that we are compensating them for their time. So I think that's great. There's one more question about if you're seeing a difference between how your system is perceived by the community and, like partners, organizations, families, etc., to assist families to accept support.
I would say yes. And I think it's a combination of factors. I think it is having so many people at the table. I think also promoting just even cross systems and understanding of what we do, what we have the authority to do, what we are mandated to do, and what we are not able to do. That alone, I think, has helped strengthen relationship just with other partners. But I think having community at the table, it's kind of this cross-sector approach, utilizing we have 9 family resource centers. We get borrowed credibility through them, right? They're trusted, and they can be kind of a liaison to our agency. We also have a really good cultural broker program where we use African-American community members to serve as cultural brokers with our community. That has significantly shifted perception, particularly of African-American communities toward our agency, which is not something that historically has been the case. And we have obviously far more work to do. And I think that it's a continued community involvement, community engagement, listening and implementing some of their strategies, sharing that power. I think that is the only way we're going to be able to shift perception from our community, particularly our communities of color.